As as Michelle said, I'm Stacia Morris, went to PACE multiple times, and I am a lot of things, doing a lot of nice, crazy stuff. Now, when I begin speaking and when I begin looking at a topic, and I should admit to you that I have not, I've been scared of looking at Medicare or thinking about Medicare, or really, I know I needed to get there and look at it. So this was a good opportunity to say, hey, I got to bite the bullet sometime. Let me bite it. And the way I approach everything is by looking at the 5 W's and the 2 H's. That's how I study. That's how, Lynn, I can pass the Series 7. That's how I can do stuff. I break it down. 5 W's, 2 H's. So that's what I'm going to do today. I'm going to talk. And by the way, welcome everybody. Welcome. Thank you for spending your lunch hour with us. So we're going to look at 5 W's, 2 H's, the why, the when, the who, the what, the where, the how much. Then we're going to look at coverage choices. Then I'm going to give you a call to action, which I've given myself. So the why and the when. Why Medicare? Medicare was first enacted in 1965 as an amendment to the Social Security Act of 1935. And it was really set up to help to pay the healthcare costs for the aged population and the underserved population who couldn't find health insurance. So that's the why of Medicare. When? There are 3 periods you should know: the initial enrollment period, special enrollment period, and the open enrollment period that we're in now. And I should tell you, I should preface all of this by telling you, we're going to give you information based on the 5 W's and the 2 H's, but then it's up to you to go look at your special situation and do your research, or there are companies that would do this for you. So during the open initial enrollment period, when you're about to turn 65, you would enroll, and I talk to you about how. Then there's a special enrollment period if you're over 65 and you have group insurance. And I want you to note that this open enrollment period that we are currently in is for people who are currently enrolled and want the best plans for their needs. So they can switch plans, they can make changes. This period is not for the initial enrollment period or the special enrollment period, or for those of you who have missed the initial or special. And I wouldn't tell you where I fit. Okay, the who. We just talked about people 65 or older, under age 65 with certain disabilities. This is bad if you have these disabilities. It's end-stage renal disease, or if you have ALS and you're under 65, then you can get Medicare. What and where? Medicare is supported basically the same in everywhere in the US. And for those of you who want to be international or retire to other places outside of the US, several Medicare supplement insurance plans would provide an international coverage benefit. In my case, I thought I would retire to my island, but my island had a volcano this year with about 1/3 of it not usable. So there goes that plan. So most likely somewhere in the US for me. What is Medicare? The what is really the part that stumbles, that's really, you have to get through to and understand it. So I'm going to spend most of my time on the what. It's health insurance provided by the federal government for people age 65 and older, as I said, and then the under 65 I just talked about. Then we talk about the ABCs of Medicare. And here is where you have to focus and pay attention. Part A is hospital insurance. Part B is the medical insurance. And I'm going to break this down a bit more, but as I'm going to cover as much as I could in 20 minutes or less by now. And then, as I said, you would do your research. Part B, medical insurance. Part D, Medicare prescription drug coverage. That's where you get your drugs. Or you can get Medicare supplement insurance. When I get to it, where you choose your individual, you've mapped your needs to what you're participating in with to your needs. I'll tell you about, I'll go back to this. So A is in hospital insurance, B is medical, D, Medicare prescription drug, D for drug, remember that, then Medicare supplements, and then on the other side, Part C covers A, B, and D. That's what you call Medicare Advantage. A lot of you may see all the ads on the TV recently. During this enrollment period, you're going to be swamped with ads. It's up to you to decide which healthcare company you want to go with. So I'm going to delve some more into these. As I said, A, hospital, B, medical, C, Medicare Advantage, D, prescription. A, B, and D we deal with first, and then C, because C covers A, B, and D. And then there's supplemental Medigap insurance. Here again, let's focus on A. Hospital, inpatient hospitals, skilled nursing facilities, hospice, and home health. And then there's some out-of-pocket deductibles. So even though A is free and you don't pay for A, you don't pay the government for A, you have to pay some deductibles, co-insurance, and co-pays. Part B, medical coverage. This would cover your doctor's visits, outpatient care, home health, medical equipment, and other preventative services. And this one, your out-of-pocket costs would be monthly premiums, deductibles, co-insurance, and co-pays. And by the way, if you have questions, keep them for the end of this program and when after Lynch finished speaking. So I just covered what Part A is and Part B. Part B and group health. Now, if you're currently employed and you're 65, and when employment ends, or if you are covered right now by an employer, a union, or your spouse, when your employment ends, three things can happen. You have the opportunity for COBRA coverage. You can get special enrollment into Part B. That's if you already had Part A. And if you sign up for B, it would start with a 6-month gap. Now, I want you to know that if you only have Part A and you haven't done B during the time limits, then you would have to pay a penalty for B. And penalties can be very severe. What's not covered in A or B? Things like acupuncture, chiropractic services, cosmetic surgery, custodial care, and as I mentioned, there are lots of deductibles. Also not covered, orthopedic shoes, diabetic supplies, physical exams, prescription drugs, and this is A or B. Surgical procedures, syringes, insulin, or travel outside of the US for medical care. Also, what's not covered in A and B is dental care, eye exam, routine foot care, hearing aids. You get the idea. A lot of stuff isn't covered in A or B, and you may have to get gap insurance. So we go into gap insurance. Gap insurance generally covers supplemental to Parts A and Parts B. And this could be variable costs, and you get gap insurance through an insurance company. Then we get to Medicare Part, back to D. And D, remember, D equals drugs. So D is all your drugs, and you have out-of-pocket costs, monthly premiums, deductibles, and co-pays. Then I did Part A, then I did Part B, and Part D. We skipped out C, because as you saw in one of the previous charts, C covers Parts A, B, and possibly D. And there's a cost to this. So if you pick up something from what I'm saying, there's a cost. There's always some kind of cost, either a deductible or variable cost. There's always cost. And Lynn would tell you how to cover the cost when we get there. So I talked about Medigap. The next thing is how. How you get Part A. It's automatic starting the first day of the month when you turn 65. And as I said before, under 65 and disabled, you get Part A. And if you have certain disabilities and you have a railroad retirement board for 24 months, you get Part A. If you have ALS and end-stage renal disease, that's how you get Part A. Some people need to sign up for Part A, and those are the people who have Social Security or railroad retirement benefits, and you may have Part A premium free, and you should contact the Social Security Department 3 months before you turn age 65 if you have to sign up, if you fit into this special group. And as I said, everything I say here, there are lots and lots of resources that you would find, but I'm helping you to cut through some of the stuff I went through and read because I didn't want to face this stuff for a while. So signing up for Part B when you're eligible at 65, and the things that can impact Part B is, as I said, your employer coverage if you're employed, if you're under COBRA, but the main thing is to sign up as soon as you can to avoid penalties. You can add Part D, prescription drug coverage. Once you have A and B, you can add Part A and B, you can add D. And as I said, Medigap, you have Medigap that will fill the gaps. You have to pay for your insurance coverage. Part C, HMOs, PPOs. So now I've done the why, the who, the what and where, and the how. Let's get to the crunch of the cost, how much. So overview, Part A, no premium, but you have deductibles and co-insurances. Part B, you have to pay, it's based on your income, and you have deductibles and co-insurance. Part C, you have to pay for the PPOs. I forgot to put that in, I'll stick that in later. Part D, you have to pay premiums, and you have deductibles, and so is Medigap. Okay, this slide. If you plan to retire before you're 65, there are lots of tools about Medicare on the Medicare website and on AARP website. And you can engage the services of a specialist. Here you have to factor in your employer provided coverage if you're under COBRA, as I said, or you can pay for individual or family coverage. You have coverage choices. There are separate rules for different people. So we can't there's no generic Medicare coverage. It's your personal situation. For example, and I give you the example, somebody on this platform who I hope is listening. This person I know has Part A and Part B, and then from her job, she has carried over the gap insurance. So you can have A and B and then have a gap that would pay the gap for everything else. So as I say here, special rules for different people, different situations, you have a range of choices, and you should make personal and timely decisions. Understand your situation, understand your options, and plan for this. And I should tell you, it takes a while to go through the alphabet soup and figure out where you fit and then plan for where you fit. Coverage choices again, the original Medicare, which is Parts A and B, and then the drug plan, Part D, and Medigap. Then Part C is where you have the HMO or PPO, and they cover literally everything. So you can decide if you want to do original Medicare or do the option using a Medicare Part C, which is the HMO and the PPO. And those are called Medicare Advantage plans, and they're all inclusive. Of course, you have to pay the price. So my call to action is that you understand your personal situation, you educate yourself, and if you are a member of AARP, there is the October 2021, so timely, there's an extract that talks about how to be a Medicare master. So I think if you get that magazine, pull that extract out and look at it. And this is what it says, how you become a Medicare master. You mind the calendar, because as I said, if you miss dates and you don't understand the timing, you pay penalties. Choose your doctors carefully. Avoid surprise bills. I'm not sure how you do that, but that's a part of the bulletin. I don't know how you avoid surprise bills. They won't be surprised if you avoid them, if you know they're coming. Know your rights, know when to do what you're supposed to do, know your calendar, and take what's offered. There's a lot of stuff under the scenes that's offered freely based on what coverage you have. Keep good records and then be open to change. And that's what this period is. This period is, if you don't like what you have, you can change it. And of course, everything comes with a cost. Here I gave you some resources, Medicare.gov. Then the best things I found in Medicare.gov and AARP. Very, very good information. You just have to crawl through it. Just crawl through it. So key considerations when selecting coverage, you have to factor in possible health needs into your decisions. Look at your family history, know your history, know what can happen, and figure that into your decisions. Sign up for Medicare when you're eligible, even if you have COBRA, and don't postpone enrolling in Part D. Then this next chart talks about the average amount of money out-of-pocket expenses that typically retirees pay that Medicare covers. And Medicare would cover 68% average of your typical cost in retirement. So you have to fill that gap. Another chart with average cost is the average annual cost during retirement could be about $6,000 to $7,000 of expenses, from hearing aids, dental, prescription copays, doctor's visit, and hospital copays. It can add up to about $7,000. So we have to figure out how you fill that gap. At this point, I'd pass over to Lynn, and Lynn would be able to help you, talk to you about filling your gap. Lynn, over to you.
Thanks, Stacia. All right, Dana's helping me move the slides here. We're going to answer questions at the end, so we'll take a look at the chat room, so I appreciate that. Dana, you can kind of move through the intro here and our disclaimers. Okay, perfect. So Stacia teed it up perfectly, because as you can see, it's extremely costly in retirement to cover the out-of-pocket expenses you still have over and above Medicare. And her estimate was, and it's actually gone up, because we estimate about $5,500 per person. So that's $11,000 per couple per year. The inflation rate we see is about 6.5%. So that's a huge number. Stacia had $7,000, so that's more like $14,000 a couple. So the key to a happy retirement is all around good health and your wealth. And I would say health is the most important thing, because if you don't have your health, then you don't really have much of anything. And I will tell you that that good, healthy habits start now, or have started long ago for you, and it will allow you to live a very happy retirement. If you want to move forward, and I think COVID also has helped us understand the importance of health for everybody in the world. So it's interesting that, you know, in the olden days, even in our grandparents' or great-grandparents' days, you basically worked and then you maybe got sick for a day or a week and then you passed away. So you really didn't have this long retirement the way we're seeing now. But because of advancements in medical, in technology, we're starting to see this is very common, that you will have 20 to 30 to 40 years that you need to plan for retirement. And I would say that that is a huge number to plan for. You know, you're planning for potentially your children going to college, you're planning for your own retirement, and now you need to plan for healthcare costs on top of that. So life expectancies have changed significantly. So there's some statistics here. I think if you move, advance the slide, you can put all those. Yeah. Perfect. So, oh, just go back one. Yeah, perfect. Thanks, Dana. So for an average, for a couple who reaches age 65 and they're married, you have a 50% chance of one of you living to age 92, a 25% chance of one of you living to age 97, and a 10% chance of living to age 100, one of you. So, you know, in general, married couples live longer. That's because probably one of the couples takes care of the other couple, of the other spouse, and then the other one could live a much longer time. So if you continue, this starts talking about the costs, and there's probably a dollar figure that comes up if you click one more. There you go. Thank you. So usually when you start out at age 65, your healthcare costs are maybe this is your out-of-pocket healthcare costs are maybe $500, $6,000 a year. That's per person. But that will increase over time to, at age 89, this chart shows over $20,000. And the statistic is, you know, the inflation rate on healthcare costs is much higher than the average inflation rate for other things. So you'll see that healthcare costs have risen, you know, 14% of a household budget in 1999, but now it's up to 31% in 2017. It's a huge, huge portion of your household budget. Now, and again, we'll talk about long-term care, but none of these costs include long-term care. You can go to the next chart. And I think we can just put all these bubble questions up at one time. Thank you. So here are the things. How will I pay for healthcare after I stop working? You know, again, that's part of your budgeting process. I strongly encourage you to work with a financial planner of some sort to, you know, make sure you have a plan in place to help cover your expenses in retirement. Yes, absolutely. Your healthcare costs will go up. It's guaranteed. Again, we estimate about a 6.5% inflation rate on those costs every year. How much should I expect to spend each year? We showed you the chart on that. Can insurance help protect from my wealth from an unexpected health event? Absolutely. Will Medicare cover all of my healthcare costs? You saw that Stacia showed you absolutely not. You need to cover that yourself. How can I make sure I'm not a burden on my family? Well, long-term care may be a solution for you, and we're going to get into that. You know, this is where you may want to consider how you protect yourself and protect your, you know, children from not having to pay for your health care. So we can move forward. There we go. Thanks, Dana. So building for your long-term health and finances can give, Merrill Lynch has partnered with a firm called AgeWave, which is a think tank between Stanford University and MIT, to study what are your biggest concerns, what keeps you up at night, what as people age 25 years plus. So they've surveyed many people, and the number one concern is their healthcare costs. You know, because it's a big unknown. You know, will I need long-term care? How much are my you know, premiums going to go up every year? So it is it is a huge worry for many, many people. And we've talked that most of the costs are your out of pocket healthcare expenses. So let's move on from here. Long-term care. So 70% of people over age 65 will at some point in their life need long-term care insurance. So you can see the dark blue on here, that's the majority of all of us will at some point in time need long-term care. That statistic is to be a call to action, but also it is the average is anywhere from somebody needing long-term care for 1 day to the person who has Alzheimer's, you know, starting at age 55 and lives another 20 years. So it's a big, long mix of needs for healthcare, for long-term care. And let me explain the definition of long-term care so people understand the difference. Long-term care, the way you assess long-term care is something called the activities of daily living, or ADLs. And there are 5 activities of daily living that that a long-term care insurance company would look at in order for you to qualify to go on to receive claims of your long-term care benefits. So those 5 activities of daily living are, if you are unable to perform 2 of the following, you could qualify for long-term care insurance benefits. Those would be feeding yourself, clothing yourself, continence, if you're incontinent, toileting yourself, which is separate from continence, and also the ability to move from a bed to a chair or from one position to another without assistance. So if you need assistance at any of those 5 things, 2 out of the 5 you cannot perform yourself independently, then you would qualify for long-term care claims to be able to be reimbursed if you have long-term care insurance. There is a 6th one, which is a cognitive. And that 6th one is if you were diagnosed by a physician with dementia or Alzheimer's, then you would also automatically qualify for long-term care insurance claims to be reimbursed. So I think there are a couple of other items on this page.
Give me 1 second, it's just frozen.
Oh, okay. Okay, yeah, we can go through all of them, perfect. So I would encourage you to go to this website to get really firm details on the cost of care for yourself. So in terms of the cost of care, there's a great gold standard website. It's Genworth's Cost of Care Survey. And the cost of care survey, you put in, I believe 2020 or 2021, gives you the a map of the United States. It's a great website. So just Google Genworth Cost of Care Survey. Just make sure you have the most current year, 2020 or 2021. And you can click on your state and you can zoom down into basically your zip code. And then you can project out, if you're 65 today, the average person needing long-term care is probably 83 to 85. So you could project out 20 years and it will show you the monthly or annual cost of all of these different things. So the nursing home, so in today's dollars, an average annual cost in the United States for nursing home is $102,000. That's a year. So if you're a woman and your average, stay in a nursing home is almost 4 years, that's $400,000. That's a shocking number, I know. And then the average cost of an annual full-time healthcare home healthcare aid is $52,000. If you live in the New York area, it's even higher than that. I would tell you that also full-time home health aid is 40 hours a week. It's not 24/7. And that home health aid performs tasks that help somebody move from a bed to a chair. They help with incontinence. They help with light housekeeping, cooking, cleaning, laundry, potentially shopping for whoever the client is, and those kinds of activities. So planning for this, if you would need somebody in your home, if you want to stay in your home, $50,000 a year over a 4-year period. But what are you doing not in the 40 hours a week, in the weekend and overnight? And so, it can become an exorbitant amount of money that you're paying in long-term care. So how do we help with this? Long-term care insurance is one way. So Dana, you can move it forward. So as we said, Medicare does not cover any long-term care. Medicaid, which we have not talked about at all, is for those who cannot afford their own medical expenses, and they have no other personal assets. So they have no other income and they have no other assets. So Medicaid actually is the #1 long-term care provider in the United States. And that's for somebody who has no assets. And they also means they have no choices, basically, in what kind of care they are getting. So we're assuming that you are on Medicare, and we are assuming that you have assets in this presentation. You need to be able to use either your personal assets to spend on long-term care if you need it, or you can depend on family members if that's something that is available to you. Or you can choose to transfer that risk or that cost to an insurance company and by buying a long-term care plan. So I'm going to go into your long-term care plan options. Yeah, so there are several types of long-term care insurance. The first is a traditional long-term care insurance policy, which you may think of almost like a term insurance policy. The term insurance would be that you pay into the program that you're willing to pay continuously until you go on claim, right? Until you need long-term care, you would pay your premiums every year. Those premiums will go over time. They will increase over time, and you really have no control over that. And usually I've experienced this with my clients, about the time that you need long-term care and you're on a fixed income and you're in your 80s is when your premium increases really go up. And I would say that please try in any possible way, if you already have a long-term care policy like this, that you continue to pay, because the insurance companies really just want you to stop paying. They've collected all your money and they've never protected you. And so I would say continue to find a way to pay those premiums every year. Now it says at the bottom here on the far right side that requires full underwriting, which means you need to qualify for long-term care physically and mentally in order to even get long-term care insurance. So if you have a chronic disease like diabetes, that's a showstopper. You would not qualify for long-term care insurance at all. And there are other specific drugs that you're on that would not allow you to qualify for long-term care. Your body mass index also is a ratio that they look at. They will review all of your doctor's visits. They will review all of your drugs that you have been on to understand whether you qualify. So I always encourage you. So I think I saw something in the chat about how old should you be when you look into long-term care? I used to say in the decade of your 50s is a perfect time to look at long-term care, but the cost is going up so much, and they've come up with some other creative products that I would say start in the decade of your 40s if you can. If you're in your 40s, long-term care expenses will be less, and you'll have more choices, and you'll be healthier, so you'll easily qualify. So if you go to the next page. So there's something called a hybrid long-term care policy that is relatively new, say within the last 20 years. And this is basically, it's life insurance, but primarily it's a long-term care coverage first. They solve for long-term care first, and then if for some reason you don't use your long-term care, there's life insurance for your beneficiaries, but it's not a big amount. It's really trying to solve for long-term care. So this is designed for people who don't want to pay for long-term care benefits without anything back. In the previous example, you use it or you lose it. In this example, you pay in, but if you never use it, your beneficiaries would reap the benefit in terms of a life insurance policy that they would get after your death. So you pay in on the far right side, the characteristics are you pay in over time or upfront, a chunk of money upfront, or you spread that chunk over a period of time. You can buy any dollar amount, say from 75,000 up. So your premium, you can figure out your premium. If you pay in $100,000, you could put in $10,000 a year over 10 years, and then you're done. So it's a defined benefit, it's a guaranteed amount, and you pay in and then you stop paying. Also, the underwriting is definitely more streamlined. It's like a 45-minute interview over the phone with an RN, or it's some of them have moved to an online tool that you answer the questions online. So the underwriting is a little less strict. Okay, so then there's a third and final one, which is permanent life insurance with a long-term care rider. So this is the reverse of what I just talked about. So if you really want your primary insurance to be life insurance, like you really want to cover your beneficiaries more than your long-term care, you would buy this product, and your long-term care coverage would be less. And then your primary desire, it says, is a life insurance death benefit. And then, even if you don't use any of the long-term care benefits. So there are a number of ways to pay for this. And it covers some essential long-term care needs, nursing home care and home health care. And the premiums can be guaranteed, or they don't have to be. You can have variable premiums. And then the focus is on the death benefit much more than on the long-term care benefits. And then you would, full or partial return of premium is not as important to these people. So again, given the requirements, they again need full underwriting. So if you have any underlying health conditions that might be chronic, you probably would not qualify. Okay. We can move on. Okay, so I would say that this is kind of the most important part of you living a great life in retirement is, creating healthy habits in retirement, but creating healthy habits before retirement, so that you are that aging healthily person. You can go to the next page. And we all know all of these things already, but as I see my clients and, those clients who are exercising regularly, I have a 75-year-old client who does flamenco dancing, and she goes all over the world and she dances and she takes classes, and it also is engaging for her social connections. So I would say that that's huge. Also, I see people who have to take money out of their IRA early. So now at this point, if you you don't have to take money out of your IRA until you're 72. Then you're forced to start taking what's called the required minimum distributions. But I do have some clients who, because they haven't taken care of their teeth, or they were inherited, teeth problems over the years. I find that teeth are the thing that they have to take money out of their retirement plans early to cover things like implants and root canals, and because dental is not covered by any of these things at this point. So take good care of your teeth, and your teeth will take good care of you. I always say that, my dentist loves me for that. But anyway, so that kind of goes with eating nutritiously, because the mouth is the window to your soul and into your gut. And if you can effectively manage what you put in your mouth, you probably will maintain a pretty healthy lifestyle. Social connections, the more and more that you are able to stay connected, and I know COVID has been a terrible thing for people, and especially aging people being isolated. But if you can get out, be outside with people, make connections, find things that you love to do that are outside of yourself, that you're giving back to others. And you see there, it says the main reason people return to work in retirement is because of social connections. But I encourage you to do volunteer work and other things that would help you maintain a healthy, healthy retirement. And then, they always, find ways to reduce stress, meditation. I swear by my Calm app, CALM, and avoid, things like smoking and excessive drinking and stress. So, and all these already. And what's next? So this just basically says, set up a plan to figure out ways to fund these costs. One of the things that we have not talked about much is the health savings account and HSA. And this would be for those people who are still working. You may have an option for a high deductible plan. And that means you pay more out of pocket. You pay, your premiums are lower, but you pay more, your deductibles are higher. And as a result, they allow you to save up to, I want to say it's $7,000 a year. It may have gone up for a family, so 2 people or more, $7,000 a year pre-tax into a health savings account. What I encourage you to do is not use that health savings account, but let it accumulate. And you can invest that health savings account just like you can a 401k plan. So basically it's a 401k plan for your healthcare needs. The money goes in pre-tax, the money grows if you invest it, and that grows tax-free. And if you use that money later in life, which you can use for your Medicare supplements, it comes out tax-free. So it's triple tax-free. It goes in pre-tax, it grows pre-tax, and it comes out tax-free if you use it for health expenses. So it's a beautiful thing. It's relatively new. Let your HSA grow, but make sure if it's growing, it's invested. So also you can choose to self-insure if you have enough assets, or like we talked about, some insurance solutions. So find ways to plan for healthcare in your future. Okay. I think Stacia and you see that I have the long hair now, the COVID hair. It's not the right picture, but anyway, let's talk. Can we open it up for questions? Stacia, you're on mute.
Yes. So Lynn, like you, I have COVID hair, but I cut all mine off.
Okay.
So one question came in just now when you were speaking, Lynn. Given the availability of hybrid long-term, why would one buy traditional long-term?
Traditional is really going by the wayside. In fact, I would say at Merrill Lynch, we don't even offer any other traditional any longer because they become cost prohibitive. The people who have them though, please keep paying your premiums. And the people I know who are already using them, some of my clients are already using them, they're phenomenal benefits. So, you know, hang in there and keep paying them if you have them. But I would say most people would not qualify for, I mean, we don't offer them any longer. Good question.
We have one from earlier. What is the difference between a supplement plan and the Medicare Advantage plan?
I think the supplement we're talking about is the Medigap that pays for the differences between A and B. And the Advantage plan is the C plan that covers everything, covers A, B, and D. Okay.
Thank you. If over 65 and covered by spousal group plan and signed up for Part A but not Part B, when should you sign up for Part B, or will you be subject to the penalty?
If you're currently covered by your spouse insurance, if the spouse leaves the job unemployed, and you may have about 6 months of COBRA, after that you have to sign up for Part B.
So
it
just
depends on
A,
employment.
just A for the spouse if they're covered.
Mm-hmm.
Now, that was my question. Now, if the working spouse is no longer working and they have retiree medical, that could also cover the spouse that's over 65, can you do that? Or do you have to get Part B at that point?
It's a really good question. That's where I would get some expert advice, just to make sure that you're not in a penalty period.
Okay, thank you.
Sorry, I'm scrolling through. I think you covered already at what age should you take out long-term care. You were saying in your 40s is the best, right, Lynn?
Yeah, if you can afford it. Usually you're trying to pay for your kids' college and stuff like that. You know, it's a challenge.
Gotcha. Roberto, are you still on the call?
Yeah, I'm still here on the call.
I saw you have a few questions in the chat. Do you want to just say it instead of me trying to read through them?
Yeah, thank you so much. Appreciate it. Yeah, I'm kind of like with a cold shower with my mom, specifically never married. She's been working part-time for a number of years now, but she still has like 30 something credits, like 31. So she's still a couple of years away from getting the 40 credits that Social Security needs to pay Medicare. So when I was trying to enroll her as she turned 65 this coming January, I thought it was just as easy as just calling Medicare and enrolling her. But I got to learn that it's free because Social Security pays Medicare. That's how it was explained to me. I'm not sure how true that is. But in order for her to enroll, she needs to apply to Social Security. So Social Security pays Medicare. So I'm kind of like a little bit at a loss here because I don't know what forms to do or how to even start with Social Security. You can enroll to Medicare without penalties. And I know that I'm against the time because now it's coming January. So I'm a little worked up with the situation now. I went to the website and I couldn't really figure out a place where to get forms or apply or anything. So I'm not sure where to start and how.
Did you call the 800 number? There's an 800 number for Medicare. Did you call that number?
Yeah, I called the 1-800 Medicare and then they said you got to call Social Security because she doesn't have credits. Okay. Then I called Security and they gave me an appointment for November 15 because they are back, but like they are too overwhelmed with work. So they were saying that she definitely will not have her Medicare by January when she needs it because she turns 65 in January. So I really don't know how to take my mom.
I mean, we could take this offline, but you may want to hire a consultant to be your advocate.
Gotcha.
But maybe you want to email me separately and I can send you some names.
Thank you.
Also, Lynn, I attended a program by Haven recently on
Mhm.
Medicare, and it was taught by an agent. So if you want that agent's name, I don't know if
The-
Michelle wants Roberta's email, you can send to both of us and we
Right.
can get you somebody.
Yeah, I just shared both of your email addresses in the chat for
Okay.
folks who might want to be in
Great.
contact with you further.
Great.
We have another question. Are we good with that? Sorry, I don't mean to interrupt.
Thank you.
The next question. Sorry?
Yeah, I was
I-
saying, yeah, I'm
okay.
all.
Great,
I see a
thanks.
question, Michelle, on international. I can't see, because I mentioned some cover. And could you see that question?
You just froze for a second while you were speaking.
On international, a question about international. Can you see that?
Yeah, I can see it now. I mentioned that some supplemental plans covered overseas. They heard of GAP plans covering travel and overseas on temporary. Well, I'm not thinking about overseas on temporary. I'm thinking overseas if you go live overseas, but that you'd have to do some research on. Because a lot of retirees we know move to Costa Rica, move to Mexico, etc. I'm not sure what the specific coverages are. But if I need to look at them, then I look at them for myself. But I think that person needs to do some research.
Okay, I have another one here. Does the whole life insurance policy have a cash value? If yes, does beneficiary get the life insurance plus the cash value upon death of insured?
Usually the death benefit covers everything, right? I don't think that the cash value, I think it's covered, right, in the full bucket.
Yeah, you don't get policy.
If you buy a
premium.
$500,000 policy and there's $100,000 in cash value, you're getting 500,000.
Correct. Mm-hmm. You don't double dip on this.
We have another one here. New York City recently got the retired city workers unions to adopt the new Medicare Advantage as of January 1st, 2022. There's a lot of confusion about the benefits. Can you comment on the pros or cons of the plan?
No,
No.
I'm not familiar with that plan. I would definitely seek out help from the human resources or, directly.
So I think you need to do two things. You need to understand the plan and then understand what's out there. And I don't know if you might have a choice, but you definitely need to understand your plan.
Okay. Let me see. We also had a few questions come in before we started the session, and one of them, I'm not sure if we can answer this. Why are dental, hearing, and vision excluded from Medicare?
I think we all probably,
Do we
anyone
know?
65 and over wishes they were included. They're clearly being discussed in these new plans, but there aren't any answers yet. Because clearly hearing and vision are significant for an aging population. So,
Right.
we don't know why they weren't
and
included.
also
It's
you guys-
probably
you-
cost related.
Right. And you all covered a lot of information, so I apologize if any of these are duplicative. What are healthcare options if I retire before I am Medicare eligible?
That is, there's Affordable Care Act is an option, and COBRA is an option potentially if you were let go from an employer or you left an employer. So there are private plans and then public plans, depending on your income level.
Okay. And
May I
then
ask
we
a
have another-
question?
Sure.
Hello, my name is Nancy. I'm a PACE graduate for many years. I am 74 years of age. I am still employed, full-time, and I pay for insurance coverage through my job.
Right.
I am planning to retire next year at 75. Do I have to reach out to Social Security prior to retirement for the supplement so that there is no penalty?
And you're asking for the B, right? You have A now, Nancy?
I have what?
Do you have A? Do you have Part A?
I have Part A since 65.
Okay.
Okay,
I
perfect.
never used it because I have
Right.
my own insurance and that's what I use, my work insurance. So I know I don't have a penalty. I don't need Part B now as I work, but I know that once I retire, so I don't know if I have to start the process before retiring or I have to be retired to start the process
I think you should start the process before you retire.
before.
Yeah,
Yeah.
yes, absolutely.
Okay, thank you.
And I think I would start, you said 6 months, right, Stacia?
Yes.
I
Yes.
would,
Oh, 6 months before?
yeah,
Yes, I would do 6 months before. If you're at 6 months, if you're at less, I'll do it immediately.
Okay. Thank you.
I think we have one last question. Where does Medicaid planning, meaning placing items in a trust, fit in with the solutions presented?
hmm. Well, I think that that's part of seeing, you need to probably meet with a trust and estate attorney and a financial planner if that's something that you are interested in doing. Or doing that for a loved one.
Or you may need to do it fast. I have friends who had to do it pretty quickly because their mother was very ill. So they met with a trust attorney so that he can tell them their options.
Right.
Right. Great. Well, I think that wraps up all of the questions that were in the chat. And I think we covered most of the questions that we received in advance. So I'd like to thank both Stacia and Lynn for their time. This clearly was a hot topic. Lots of good conversation and lots of great questions. Our next finance session will be on December 1st, and we're talking about exciting year-end tax tips. So we hope you'll register for that and join us for that as well. Everybody have a great week, and thank you so much for joining us. We appreciate you coming out for these virtual sessions and glad that you find them helpful and enjoyable. We will be sharing the recording on our website in a few weeks. So you'll be able to see the recording again.
And the
for those of-
presentation.
Yeah, for those of you who asked if we can share
Yeah.
the slides, I'll speak with Stacia and Lynn and we'll figure out if we can do that and how to get that to you. Okay,
Thank you.
Great.
thank you all
Thank
so
you.
much.
Okay, bye.
Bye-bye.
Thank you
See
very
you
much.
later.
Great day.
Bye, Dana. See you, Michelle.
Thank you.
Bye, Stacia.